Congressman, you're no stranger to the actual application of intervention with a family, intervention with a youngster who is troubled. What is your perspective on this general topic, and do you think there are things Congress ought to consider, laws that can be drafted and passed that can put us in a better position?
I've studied this for years and wrote a book about this called The Angry Child, and which been laid out for years. There's a dynamic between parent and child and environmental issues. Video games don't cause it. We're chasing the wrong rabbit down the wrong hole. But the military does use that to enhance their skills in action, etc. The issue is we need to be addressing mental illness, and we're not. Once again, we're going to dismiss it in some other ways. Look at the way we've handled this historically.
When you say we, you mean Congress, the federal government?
The nation, the world.
Okay.
We've locked people in prisons. We've burnt them as witches. We exorcised them as possessed. We did all of these things, and then we dumped them out of the streets, emptied hospitals, somehow in the name of compassion, and now they're out there in the streets or they're in jails. This is the wrong approach. What Congress has done, what the federal government has done, is oftentimes funded the wrong things. The National Institutes for Mental Health budget is very small. In my role as chairman of the Oversight and Investigation Subcommittee, we're going to look at this. And we're also looking at tremendous waste. For example, SAMHSA, Substance Abuse and Mental Health Agency. I got to show you this. They funded painting this picture for $22,000. Our tax dollars going through that. Now, I have no idea how this is going to help anybody get any better. SAMHSA is filled with all sorts of waste like this. They're funding programs to tell people how to get off their medication. We need to be finding ways to get people help and not going down the wrong things and making sure federal dollars are spent wisely to help families and help kids in these instances.
Mike, I know you're eager to jump in on this. From your vantage point, what the Congressman talked about, is there a misapplication of federal resources, federal intentions, and are we missing the boat on this idea that maybe video games play a large role in this entire saga?
60% of the people in this country that have a diagnosable mental illness on a given day receive no treatment. What we really need to focus on is to rethink the mental health system in America and focus on early intervention, early engagement, diagnosis, and treatment. Too much time is really spent, Major, on the back end of the system. We need to get help to families. Families are on the front line. They understand what's going on with their children, and it's HIPAA laws and local statutes.
Stop you there. HIPAA, yes. Meaning to help our viewers understand.
Well,
that.
The federal laws that talk about confidentiality and
right.
what schools and other entities can share with families. And too often we see families as being isolated. Families and friends can see what's happening with a loved one or someone they care deeply about, and they should be part of the larger conversation.
And when you talk about 60% with a diagnosable mental illness not receiving treatment, from your research and your understanding, what's the cause of that? Is it stigma? Is it a sense of being afraid? Is it a sense of a lack of resources? What are the underlying factors?
It's a number of things, Major. It's in the last 4 fiscal years, $4.35 billion have been cut from the public mental health system. That's a problem. Stigma is enormous in this country. In this country, we don't grow up going to a psychiatrist. So for a family to move forward and understand what they're seeing is a difficult proposition. So education needs to take place in communities with families to have them understand what they're seeing and to take the initial steps. We need to educate school staff. We need to educate law enforcement. We need to educate families. We need to have them communicate with each other to be able to identify mental illness and then take those first steps to get people into treatment.
And I want to go back to the point that Tim made at the top, and I just want to ask everyone here. He described a video game of shooting a police officer, urinating on him, and watching him scream. Now, I'm not asking anyone if that's the cause of violence. I'm just asking, would you watch that? Would you have your children watch that? And what is the value of that? And is there anything culturally, from just a common sense perspective, people ought to say, you know, I think we could probably live without that, Congressman?
We could. It's disgusting. There's no role for that sort of thing. And parents need to be watching these things vigorously and not simply using video games as pacifiers. Most people can handle these situations, but it does go back to the situation of the early prevention, early identification, giving people the tools for that. What has happened in our society is it isn't just we've made cuts. We actually are spending more money because we're putting people in jail now. And it's left to police to deal with this. And then to have video games which are attacking police are not helpful at all.